Courtney. This is Ashley. This is Marissa. And this is Angie. And we are your Patient Education Committee. In this video, we are going to be showing you how to do a central line dressing change. But first, let's talk a little bit about central lines.
A central line is a catheter tube that is placed into a large vein directly into the heart to administer fluids, medications, and draw blood for morning labs. Because it's a direct access point to the heart, it is so important to keep the line clean to prevent any bloodstream infections.
Central line infections, or Klebsiella, are caused when germs or bacteria enter your bloodstream through the central line. These infections can sometimes be serious or fatal.
If your child is undergoing chemotherapy or getting a bone marrow transplant, they are more at risk for getting a central line infection. Let's talk about ways to decrease central line infections. The first way is to always wash your hands before doing a central line dressing change. The next way is to always wear a mask whenever you do dressing changes. The next way to decrease infections is to use antiseptics or chlorhexidine when doing a central line dressing change. And the final way is to always change your dressing every 7 days, or if soiled or if lifting up.
Now that we know a little bit more about your child's central line, let's get started. Courtney is going to demonstrate a Broviac dressing change. If your child has an apheresis catheter, most of these steps will be the same. This is our patient for today. His name is Chester Chest. First, we'll start by preparing our table. Make sure that you clean the area before you get started. Next, wash your hands with soap and water. Make sure you have all the supplies needed. For this dressing change, we will need a central line dressing change kit, a BioPatch, a Tegaderm, sterile gloves, and a mask for each person in the room. We also have adhesive remover to help remove the dressing. Everyone put your mask and blue gloves on. Now we will prepare our sterile field. The first step will be to open your central line dressing kit. Most dressing change kits will also come with mask and gloves inside. You can set the gloves aside. You want to only touch the corners as you're opening it up. Once your sterile field is open, it's time to drop your other items on the sterile field. It is important that you open them in a way that you are not touching them or the sterile field. It is now time to take off your child's current Tegaderm. You may use adhesive remover to do this. You want to do this slowly so that it will not hurt your child. Make sure to try and not touch the line if possible. This sometimes can be a little tricky and takes some practice. It is now time to get sterile and put your super clean sterile gloves on. This part can also be a little bit challenging and takes some practice. Open the folds of the gloves packet. If you are right-handed, it is easier to do your right hand first. You will use your left hand to pinch the edge of the right glove and slowly pull it up. You can now use your right hand to pick up the left glove and place it on your hand. Don't worry if your fingers aren't in the right holes. After both gloves are on, you can adjust them. Remember, once your sterile gloves are on, you cannot touch anything that is not on your sterile field. It's cleaning time. Open your chlorhexidine packet. It will have a swab inside. It is important to start in the center where the line is inserted into the body and move outward to prevent contamination. You want to do back and forth motions. You may choose to use sterile gauze to hold the line in place if needed. Make sure you use the light pressure when cleaning. The friction helps in the cleaning process. You want to cleanse the whole area that is going to be under the Tegaderm. Don't forget to clean the tubing as well. Wait for it as it dries. This may seem like a long time, but it is important to completely let it dry because the drying is part of the cleaning process. It also prevents skin from becoming irritated. While it is drying, you can get your Tegaderm ready to go. You will know the skin is dry when it is no longer shiny. Place the BioPatch. The BioPatch has a slit in the middle and should be placed around the tubing where it meets your child's chest. The BioPatch always goes blue to the sky. It is now time to arrange your line in the way that works best for your child. Remember, it is important to loop the line. This gives the line leverage in case the line becomes pulled. Place the Tegaderm. It is important for the whole line and triangle to be under the Tegaderm. If your child has an apheresis line, there might not be enough tubing to make a loop, and that's okay. Make sure to press down on all the edges as you're removing the line to make sure your dressing stays occlusive. After the Tegaderm is in place, it is important to put the time, date, and initial of the person who performed the dressing change. You may also choose to use additional tape to hold the tubing in place. Now your dressing change is done.
You did it! Remember that practice makes perfect, and the earlier you begin, the more comfortable you'll be at it. Thank you for watching this video on central line dressing changes.